Hey, look at that. We're live. What do you know?
Hello, hello.
Hi, friend. How are you?
Doing well. Can't complain.
Excellent. Good to be here with you again. What's new with you?
Not too much, except we have the conference coming up, and we will be there to talk to people about OCD and SUD. Uh, Doing a formal presentation. 1,000 is too many. One is too many, and 1,000 is never enough.
There you go.
On Saturday, we'll also have a 12-step meeting Friday evening, and I believe the SIG is somewhere in there, the special interest group, but I honestly don't remember.
Yeah. Well, we'll get there. So,
We will.
anything new in the OCD SUD world there, my friend?
Not much that I have heard of, but as always, we are constantly trying to put some new information, new resources, videos that we find, things that people are putting together on the website, OCDSUD.com. So that is a good place to go for resources. If you have struggles with OCD or SUD, if you need family information, we do put stuff there. We try to share as much as we can. But as we've talked about before, there's a dearth of information regarding OCD and SUD, although they are wildly concurrent disorders.
True that.
Yeah.
Christina asked a question: are the conferences ever on the east side? Yes, next year will be on the east side if this year's on the west side. So that's usually how they do it.
Yes.
So definitely, you will see one on the east side next year.
Yes. Don't no. Yeah, we'll definitely be on the east side, and it will be in a warm state. I'll just say that.
Yeah. I don't know if they've announced it yet, so I don't want to say.
No, they announced it at the conference, so you got to wait a couple more weeks, but it will be warm. It's July. I guess it's warm everywhere. And but they do move them around, which I think is good because it gives people an opportunity to attend and not have to travel that far.
Yeah, it's great. It's great. Well, what should we? Let's see. What made you two? Tyler asked this. What made us two interested in helping people with OCD and substance use?
Well, I have both of those disorders. I've been in recovery from substance use disorder for 29 years. And in terms of recovery from anxiety disorders, OCD, PTSD, I say about 20 years because I really still did engage in a lot of compulsions, rituals around anxiety, avoidance into my recovery from SUD. And that's when I really did my therapy. I did a lot of CBT in the beginning, and then I found a therapist that does ERP. And that was a game changer for me. That really made the outsides that were looking good because of my SUD recovery match my insides. Because everybody told me how good I was doing. Oh, it's great. You're working, you're, in recovery, you show up. But I had a lot of internal thoughts, intrusive thoughts, compulsions, what I was doing that made the inside very uncomfortable. So that's where my interest came. I became a social worker. And one of the reasons for that is I wanted there to be more effective treatment for SUD. And then I realized there needed to be more effective concurrent treatment because for a lot of people, the SUD is not going to get any better if you're not able to treat the OCD or other anxieties.
Did you notice that after stopping substances, OCD seemed to feel stronger and more difficult?
To be honest, I sometimes don't know how I got through the first 4 to 5 years of my recovery. I was white knuckling it all the way through. I did what people told me to do from the SUD community, but I had a lot of struggles with the still intrusive thoughts, compulsions that I didn't even understand what they were. And when I was first, got my first anxiety disorder diagnosis, it was PTSD. And it's not an inaccurate diagnosis for me. However, OCD didn't come until much later down the road. And a lot of the things I was told for PTSD didn't help OCD. And so I'd still spend hours thinking about, I'm going to like flip out and, take people out on the bus. Like, I'm just going to go down and punch everybody in the face. And when you're sitting on the bus and you have that thought, like, oh my God, I'm going to hit everybody on the bus. I'm going to be arrested. I'm going to lose my job. I need to get off this bus. Or I need to sit on my hands. Or being told that because of my PTSD, you've experienced violence, you will not become a violent person, did nothing for the OCD and the harm OCD that went through my head. So I was stuck for a long time until I found somebody who understood ERP.
Mm-hmm.
So yeah, those first couple of years were extremely challenging and difficult. I did have a sponsor who didn't have any training in mental health, but she had a way of saying, you might be right. I'd be like, I'm going to die, from this heart flutter I think I have. And she goes, you might be right. So she sort of cut it off at the knees. And I think it slowed me down a little bit, but it didn't stop it until I got into formal treatment.
Mm-hmm.
And that's why I say there's a difference of where I feel my recovery started for anxiety disorders and where my recovery started for SUD. The difference is about 9 years. And that in itself is challenging.
Mm-hmm. For me, it was I got a postdoc with the famous Alec Pollard at the St. Louis Behavioral Medicine Institute after I was finished with my internship, and it was in the Anxiety Disorder Treatment Center. And within about a week of being there, I thought, yep, I think this is what I'm going to do the rest of my career. And it has been what I've done for the rest of my career. 23 years later now, I am still working with people who are anxious and have OCD and loving it very, very much, and can't see doing really anything else but that. And then in terms of substance use, the hospital program that I was at had another intensive program for substance use, and we would get a lot of crossover patients from the substance abuse program. And so that started me learning about all sorts of folks with substance use, and then working with our friend Margaret Sisson and her foundation of Riley's Wish Foundation when her son died of an overdose. And then I was fortunate enough to open one of the first treatment centers that would treat people that had OCD and substance use at the same time, without saying you had to get sober first, and then after getting sober, then you can work on your OCD, which I never really agreed with very much, because I just thought you're stealing away people's coping strategy, the substances, and you're just then not giving them anything for 90 days and making them suffer for 90 days. And that just didn't seem like a good idea to me.
Yeah. That's one of the hard things when you have, what's often referred to as co-occurring or dual diagnosis of SUD, is a lot of people who want to treat your mental health aspect want you to be sober for 30, 60, 90 days. And a lot of people don't get there. And so it complicates your access to treatment.
Mm-hmm. So then we met, Stacey, at some conferences and started the OCD SUD special interest group, and you want to tell everyone what you do and where you're at currently and everything. Mm-hmm.
Current with the SIG.
The SIG, and then your job too, because this is a lot of what you do for work as well.
Yes. Well, I work within the VA healthcare system, and so I work with a lot of veterans who have mental health disorders. I've worked with a fair amount of individuals who have OCD, both in the VA and outside of the VA. I'm kind of a unicorn in that respect. The VA is more known for treating PTSD, obviously, for veterans. They don't have a lot of treatment providers that are trained in OCD, ERP, or OCD and ACT. And then I do some trainings through conferences, and I've done some consultative work as well, trying to teach other professionals how to treat OCD more recently. And I also, co-facilitate the SIG with you.
Yep.
And I have other individuals who are helping me with the website and gathering information. There'll be a group of us at the conference putting on a panel. There will be 3 therapists, 1 therapist in training, and 2 of us have lived experience as well. So we're getting a core group of people who want to expand and give resources to concurrent treatment and to the people in the community who need someone who understands both issues.
Yeah.
So, and I'm also working to bring OCD awareness to the SUD community.
Which is a big deal right there. Yeah.
Yes. Yes. So we work mostly within the OCD community to bring them knowledge of SUD, but I'm now working with the SUD treatment community and conferences to bring them more OCD treatment knowledge. So, trying to tackle it on multiple fronts.
Yeah. And I'm the Chief Clinical Officer here at NoCD, so happy to be a host tonight. And NoCD's got an online platform for the treatment of obsessive compulsive disorder and hoarding and body-focused repetitive behaviors and tics. So if you're looking for treatment in Australia or the United Kingdom or Canada or the US, and in the US you need insurance coverage, check us out, because we will do all that we can to help you. So, Stacey, we got bombarded with people and questions here suddenly. It's amazing. So if there's any particulars that you want to grab, feel free. But let me see what else we got. People ask if I still do therapy. I do still see some people, but only in the states I'm licensed in. So if you're not in those states, then there's other folks as well too. Dominique says, is it normal to outgrow compulsions and form new ones? It's not that you outgrow them. You often see a change in obsession, which leads to a change in compulsions. And why? Because OCD is like a game of whack-a-mole, and it likes to bounce around in many ways. That's why.
Yeah.
This is a good lived experience one for you, Stacey. How do you know the difference between compulsions and actual desires?
A desire moves me towards something that's important in my life, a value that I hold. A compulsion is something I do to take care of an obsessive thought, to fix it, to mitigate it, to change it, to avoid it. So the desire is enjoyable. The compulsion is work.
What an excellent answer. Mm-hmm. Any advice on the recovery process for meta OCD? I'm dealing with being obsessed with OCD itself and that it won't ever go away and I'll forever be miserable. It's a tricky one. Jason and Stacey, tell me what you think of this, because this is what I would say to you, Stacey, if we were together. Stacey, you're going to have OCD for the rest of your life, correct? I know. Yeah, I know you're shocked. I mean, staying there. But Stacey, I'm going to follow up with the second part of that. Are you forever miserable because you have OCD?
No.
Why not?
Because I have figured out the difference, going back to the other thing, between a desire and a compulsion. And
Okay.
I've done my treatment. So OCD is still there, but it's more of a background noise. And when it shows up, I can acknowledge it, but keep moving in the direction that I want to. And every once in a while, I do trip over it. I'm not going to say it's perfect, but
Sure.
I know when I do. And I can say, okay, so I tripped over it. I'm going to go back to doing what's important to me and wait for it to show up again. But the power and control it has over my life today is minimal.
Fantastic. Love that. Love that. So I often use the example, I have tinnitus, so I'm always hearing a sound ringing in my ears that no one else is hearing right now. It's very loud right now because I just said the word tinnitus, and it gets very loud once I say tinnitus, but it will fade into the background again. And though I'm always hearing it, I'm not always paying attention to the fact that I'm hearing it. So there are people who have said tinnitus has ruined their lives. And there's other people like myself who are just like, yeah, I have tinnitus. It's annoying, but I move on. It has not made me miserable, and it has not stopped me from doing any of the things that I really want to do. I may do some things differently. Like if I'm somewhere and there's a loud siren coming down the street, I'm one of those people that plugs their ears when the siren goes by because I don't need it to make the tinnitus any worse or anything like that. But I'm okay with that. And if people laugh at me, fine. I don't care. Whatever. That has no bearing on my life whatsoever. So we can all learn to live with things that are uncomfortable, even if we don't believe that we can.
Yes. And sometimes it will just pop up. This wasn't my thing, but I was with a friend and we were at SeaWorld and they have this option to feed sharks. And we thought, hey, that sounds really cool. So we paid the money and they handed us a, platter of raw fish. It was like, okay, what do we do with this? I was like, we feed the sharks. And they're like, okay. And they're like working on it, picking it up, and they're like, and then not wanting to go in and scrub your hands like you're preparing for surgery. And we both acknowledged that it was a contamination exposure ERP opportunity that just came up in the real world. I mean, yeah. I don't know why we thought it would be like cooked fish and it wouldn't be squishy and smelly and all of this because that's not what fish eat. I'm like, okay.
Yeah. Oh, yes. Sharks prefer a lovely broiled salmon, by the way.
Yeah. So you do have times in your life where it just shows up. But we both kind of chuckled, had our struggle with it, and then took care of it and went on to the next thing,
Mm-hmm. Janelle says she's scared she'll never view life the way she did before existential OCD, thinking that people are fake or hyper awareness of consciousness. OCD loves you to think in terms of all or nothing like that. So OCD is a big fan of you, hopefully thinking that you'll never be able to be the way that you want to be, because then OCD's got you in its clutches, because OCD will put a little carrot out in front of you that will say, but maybe you could. And the only way to do that, of course, is to do this compulsion. So Janelle, just keep doing these compulsions and maybe you'll get to where you want. And of course, OCD just wants you to do that because OCD eats compulsions for breakfast, lunch, and dinner. And that's what it wants you to do. I would ask, do you ever have to be the way that you were before existential OCD? Or could you just be a person who gets through it, and in all the learnings that you did to get through it, is a stronger and even better person than you were prior to having OCD, right? That's a possibility as well too. OCD will never have you think of that as a possibility, but it is a possibility, right?
Yes. It's the concept of my mess becomes my message. As you get through this, you can help others who you may not even know that are out there.
Yeah.
That are struggling with existential OCD. So it can make you a stronger person, and then it can assist you to help the next person down the line.
Yeah. I'm going to bet every person who's gone through substance use disorder treatment has, in some ways, thought how nice it would be to go back before I had my first drink or my first hit and never have done that, right?
Yes.
Yeah. No one's been able to do that. We don't have time machines, so no one's been able to do that, right?
No.
Okay. So then what do people who think that, how do they live and function and survive day to day?
You realize that it's all part of your journey. And, there is some acknowledgement that both OCD and SUD steal one thing, time. And being able to work within your treatment and your recovery and find your supports gets that back for you. It gets time. Time stands for things I must earn. It also stands for today is mine, enjoy.
I like those.
It has two meanings, but the truth is both of these disorders steal time. And acknowledging that is part of the process. I always felt like I was 10 years behind. And when I went to school, I was 10 years senior to my undergrad classmates. I was 10 years senior to my graduate school classmates. And then when I entered the professional field as a therapist, I was already 10 years older than the people I was, entering the workforce with. But as time went on, that balanced off because I had a lot of life experience to draw on that helped me make further leaps in my professional development and career path that were not yet available to those that didn't have those years of life experience. So, do you lose some time in the process? Yes, you do. But with, continued work and treatment, that becomes a stepping stone rather than a barrier or a problem.
That's really good. I like those definitions of time too. Mm-hmm.
Yeah. I'm really good on, short-term acronyms.
I think it's a 12-step thing, honestly, isn't it? I mean, you guys love an acronym.
Yeah. Like fear.
Mm-hmm.
It's, forget everything and run. Or the opposite, face everything and recover.
Mm-hmm.
It's got one more too. False evidence appearing real.
That one I've heard. I like that one. Yeah. Mm-hmm.
Well, that's a very OCD one. So
that's a good OCD one. Yeah. Mm-hmm. Yeah. Let's see. We got that one. Omar says, I'm scared of recovery because I feel like once I do recover, I'll realize my fear is true. Sounds to me like another OCD trick to kind of try to keep you from recovery. Because OCD will say, but if you don't have me anymore and you just accept your thoughts or your images or your urges, does that mean that you actually like them or want them? And if you don't do a compulsion to neutralize them, it must mean that you accept them. And what horrible, awful, disgusting kind of person would accept those thoughts or images or urges? And the answer to that is everybody without OCD who has randomly weird and intrusive thoughts every day. And after they have them goes, oh, that was weird. And then moves on with their life without doing anything to neutralize it whatsoever.
Mhm. And we see some of that with SUD as well. When people get into early recovery and they have a craving or an urge to use a substance, or they walk by a bar and they start thinking about it and they're like, oh, that must mean that I want to drink or use or be high, or I can't live without it. And it's just it's a thought. It can be a craving. If you change how you respond to that thought or that craving, you can move forward. But it will tell you, oh, well, if you feel this way, you must want it, you must need it. And some people buy into that and end up relapsing. The craving will pass.
Yeah.
The craving's not the problem. The response to the craving for substances is the problem.
And we could say the thought or the image or urge is not the problem. It's the response to it. Mm-hmm.
Yes.
Yeah. So I've heard that one so many times that Omar brought up, that what if OCD is the only thing stopping me from being XYZ, right?
Mm-hmm.
But my standard response to that is then, so we could have stopped all murders by just having given OCD people to people who are murderers, and then they would have never murdered anybody because they would have had OCD. That would prevent all crime in the world. Actually, if from now on we want a crime-free society, we should just give everyone OCD when they're born, and then we'll never have crimes ever again. Sounds kind of ridiculous, right? But it's almost what Omar's wondering there. Mm-hmm. Like, shouldn't we all hold on to this just in case? Because if this is the thing that's stopping the bad thing from happening, why would I let it go?
Yep.
Mm-hmm. Okay. Interesting. I was doing a talk recently for OCD SoCal for Chris Johnson, and then I did a talk with Liz McInvale and Chris, and we talked about the idea that OCD does not have your best interest at heart.
Nope.
And if it did, we would want to give it to everybody, because why wouldn't we want to share something that's so wonderful and has such great interest in you with everybody else in your life, right? As it turns out, OCD does not have your best interest in heart. OCD only has OCD's interest at heart. And OCD will tell you anything that it possibly can to scare you into keeping OCD around.
And the same can be said for SUD.
Yeah.
It just tells you one more. This one I'll take care of this, And it doesn't have your best interest at heart. One, as the talk says, is too many, and 1,000 is never enough.
Yeah.
It's true of compulsions, and it's true of substance use. If you have a substance use disorder, there's, it means that you've lost a certain amount of control over substances once you put something in your body. And it just lies. It tells you everything will be okay. And then you wake up, and you feel worse for using. And everything you were worried about is still there. The OCD is still there. PTSD is still there. Your bills are still there.
So, Stacey, you're this may come as a shock to people, but you're telling us that taking substances didn't make everything better?
No. Despite many, 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 many trials on my behalf, I worked diligently to prove SUD right.
Yeah.
Yes. Never worked.
Never worked. Okay. No. Missionary Dylan says, tips for solipsism OCD. I feel like I'm the only one alive. And whenever I hear feel like, I always say that's not good use of our knowledge base, right? We're going on emotional reasoning there versus versus any form of logic. Although OCD doesn't use the style of logic that everybody uses. OCD has OCD logic, which is very different from non-OCD logic. In OCD logic, anything is possible and could happen, and all you need is a what if question, and then it's a very valid thing to research, seek reassurance on, ask other people about, pester other people about, whatever it might be. OCD loves the term "it feels like," and I hear this all the time. And I always pause people when they tell me something feels like, because I say, I'm not very concerned on what it feels like, right? Because here's the deal. We know what it feels like. We know that it feels anxiety provoking, uncomfortable, shameful, guilty, disgusting. We know that that's what it feels like already. We're very, very familiar with what it feels like. So you don't have to tell me what it feels like. I want to know what you actually think outside of what the OCD is telling you to feel, because what you're doing then is having those feeling, and because the feeling feels so real, right, as we always love to talk about, it must be true. And why would I have this feeling if it wasn't actually true? And so you have to conjure up thoughts and all sorts of things that go along with the feeling, and then you believe those because that's what you've done to match the feeling. But you could feel like you're the only one alive. Does it actually make it happen, right? And OCD is going to say, those other people around you, they're not real. And, or what if it's all an imagination or a mirage or anything like that? And you could go, wow, that sounds like something to spend the next several thousand hours contemplating. Or you could also say, whatever, and live your life. And then OCD is going to ramp up if you do that and get worse. And then you're going to say whatever, and it's going to ramp up. It's going to ramp up because the OCD is a kid in a candy store, and it's going to keep throwing a tantrum. But there's going to be some point where it's not going to throw a tantrum anymore, because OCD is going to realize, oh, well, Dylan is no longer giving in to what we want Dylan to give in. Dylan has stopped feeding us. So this theme is now done. It is now over because it is not being fed anymore. But Dylan, as long as you feed the theme gets bigger. Some of our therapists have signs in their offices. I see them in consultations, and it says, please don't feed the fears.
Yes.
Natalie says, what would you say to someone who has a bad OCD day and starts to think that remission isn't possible? I'm sure you never had a day like that, Stacey.
Oh, no, not at all. Everything's been flowers and butterflies
and rainbow farts of rainbows,
yeah.
or unicorn farts of rainbows. Yeah.
Yeah.
Mm-hmm.
Mm-hmm.
Yeah.
No, I mean, life has its ups and downs. A lot of times stress is going to nudge OCD and SUD. We know that for SUD, stress leads to cravings. It's a hormonal response that happens. And when people are stressed for whatever reasons, we see it a lot when people with OCD who've been in treatment go off to college or move to a new state, or when you start a job. These are all positive things in your life that can add stress, that can have your symptoms rising for a period of time. And then if you have, negative stressors, family member with a health issue, a loss of job, financial stress, your anxieties and cravings may return and go up. And being aware of that I'm entering a time of my life that involves stress, whether that's stress from a positive thing or a not positive life event, can help you, one, reach out to more people for support, two, do more self-care and focus on self-compassion. Now, there are times where I give in. I consider myself in long-term recovery, and it just gets in my head, and I do not have the mental energy because of the day that I've had to fight. I give in. I know I'm giving in. I know it's not good. And I do. I think, what, but then I'm like, okay, moving on, moving on. Because it steals more time for me to be judgmental about the fact that I struggled. And so I'm like, I'm not going to judge myself for struggling. I'm going to move on and do the things I know are healthier for me to do. I'm going to give myself compassion, and I'm going to get back on track rather than spending an additional hour, day thinking, oh, I could have done so much better. I can't believe I did that. It feeds upon itself and becomes that never ending loop. And when you do that, the irony is that the symptoms of anxiety and OCD go up. They don't go down with self-judgment. They go up. Self-judgment does not lead to resolution. So
I've not found people with OCD thinking more about things getting better.
No. And when does your brain go, what if you are wildly successful?
Oh, come on. That would never happen. Why would I ever think a positive thing, right?
Yeah, I know.
Yeah. No one's ever walked in my office and said, I'm afraid everyone loves me and thinks I'm awesome. Can you help me with that?
Yeah. Mine either. Never heard it.
Yeah.
Nope.
Yeah. No, it's never great things, right? It's always awful, horrible things.
Yeah.
Stephanie says, hello, you two. I have repeatedly confessed real events that have happened during mine and my partner's relationship to your partner. Every time you've confessed, the memory will always come back up and down the line, and I will have to confess it all over again to my partner. It also forces me to add one more detail every single time. How do I deal with this? Boy, if that's not a once is never enough, right? 1,000, yeah, 1,000, yeah, just, yeah.
Yeah.
Yeah. How do you deal with this? Well, you stop confessing, right? That's how you deal with it, because any safety behavior that's provided. So you see this in all 5 safety behaviors. You see over time you avoid more things, not less things. You want more reassurance, not less reassurance. You use more distractions instead of less. You use more substances instead of less. And you do more compulsions instead of less. So OCD only demands more, never demands less. So how do you deal with this? You recognize that you're never going to be able to do enough for OCD. Stacey, do you know one person in the history of your treatment of OCD who's ever said to you, I finally did enough compulsions. OCD said, I'll see you later?
That would be a big fat no.
Okay. Why not? Why hasn't that happened?
Because OCD is never satisfied. That's not the purpose. The purpose is to get you to continue to compulse.
Right. Right. And if substance use is one of your safety behaviors, you're going to use more substances, not less. Stacey, in all your work on this, did your substance abuse problem decrease over time or increase over time? Okay. So we can build up a tolerance to every single safety behavior. We don't just build tolerance to substances and alcohol. We build tolerances to reassurance. We need more reassurance today than we got yesterday to feel the same way that we did yesterday. Right? So I think Stephanie really hits the nail on the head here when talks about it's always a +1 every new day, every new time. There's got to be a little bit more. Right? You'll never hit the end. And even if someone with OCD ever even had an inkling that they were getting close to what they needed to do, OCD would say, okay, cool. Now round 2.
Yes. we're going to shift over here.
Yeah. And guess what? There's an infinite number of rounds.
Yes.
So, and let's say you lived long enough to go through the infinite number of rounds, even though it's infinite and that's stupid, but I understand that. It would come back to the beginning one again and go, did we really do enough on this one though? Let's check. And then you'd start all over again. Mm-hmm.
Yes. Yep.
Maybe one of the largest mistakes made in obsessive compulsive disorder is believing that there's an end point.
I think that's one of the largest mistakes in a lot of even in substance use disorder.
Mm-hmm.
You know, that goes back to how do you define recovery? Recovery for me does not mean absence of all anxiety or cravings ever. It means that I can acknowledge when it shows up and move in a different direction, and that it doesn't have control over my life. It's not in charge. I'm in charge. It's just somebody or something that comes along with me today and occasionally taps me on the shoulder and goes, I'm still here.
Yeah.
But people will judge themselves as not in recovery because they have an obsession or they give into a compulsion or they have a craving for substances or they think about it. And recovery is life. It's a process. It's not this clear-cut event. Things are going to pop up. You're going to have thoughts. You're going to have feelings. And I don't think we've defined.
I don't want to have thoughts and feelings. I want everything to just be status quo.
Yeah. Not going to happen.
Well, that's not fair.
Well, whoever told you life was fair lied.
Well, I'm really disappointed in those people right now.
Yes. But I think there's this perception that symptom elimination equals recovery. And it's more symptom reduction or moving towards what's important to you and bringing some of those symptoms along when they pop up.
Yeah. You can have a surgery for something and still have symptoms afterwards.
Yes.
You may, for the rest of your life, if you have a hip replacement, never quite walk the same as you did prior to the hip replacement.
Right.
Does that mean it was a failure? And will you just long for, oh, I wish I could walk the way that I did prior to? Some people may do that and just be miserable for a long time because of that, instead of, all right, well, hey, I got a new hip now, potentially a new lease on life. It's a little bit different. This hip drives different than the old car drove, but you know what? I'm gonna take this new hip out for a test drive, and I'm gonna learn to adjust to it and live with it the way that it is, instead of mourning for the fact that I don't have the old one in the way that it was when I was, 20 years old and everything was fine.
Yes. And Patrick, but a lot of people here may not know, I'm also legally blind. I've been legally blind since the day before.
What?
I know.
Oh
Yeah.
my God. I'm in shock.
Around with that big white stick might be the first thing.
Is that I just thought it was a fashion accessory, Stacey. I had no idea.
Actually, I just do it for the free bus pass. I've got you all snowed. I can really see. I just like the free bus pass. But it's that concept of I'm going to go and do the things that I want to do.
Yeah.
And my vision's not going to change. I'm going to build the life I want around it and work through it, and also not let other people set my limits.
You do more than most people I know who are fully 2020 or whatever sighted. That you do more than almost everyone I know. So,
I've hiked the Grand Canyon.
Yeah.
I was like why not? Let's do this. They give me 2 poles to feel around with. I'm like, okay, don't go near the edge. I'm
Yeah,
good.
you're good there. Yeah. Uh-huh.
But
Yeah.
I think the concept is some things are going to be different in your life once you are diagnosed with OCD, SUD, or you have a big medical event. But it doesn't mean that you can't live the life the life that you want. There are certain limits. Okay, I want to drive. This is a very bad idea.
Yeah.
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 So I'm not going to say there aren't limits. There are,
Yeah.
but there are far less than people anticipate when they find out I'm legally blind. Same with OCD and SUD. Recovery doesn't mean elimination of struggle. I lose so many things in my house on a day. I put my phone down. Fortunately, I have a work phone, so I can call my personal phone. Okay. When I retire and only have one phone, I am going to be in so much trouble. I'm going to have to like put one of those tags on there
Yeah.
so I can find
Yeah.
it.
So you can find it. Yeah.
But yeah, that's right. So I guess what I'm saying is it's not that there are not struggles with whatever it is you're dealing with, but you can still build your life around them and move towards the things that are important to you.
Absolutely. Catherine asks, what's the difference between ADHD and OCD? So attention deficit hyperactive disorder is difficulties with being able to maintain attention or focus, versus OCD. You might see that. You might see that people are having trouble maintaining attention or focus in a certain area, but the reason for the lack of attention or focus in someone with OCD is because they're experiencing intrusive thoughts, images, or urges and doing compulsions, which could be mental or physical behaviors to try to neutralize those things. Versus people in ADHD, that's not the reason why they're not paying attention. It's just the way that their brain functions, and they can be trained to pay attention and to learn it through good behavioral practices. And there's also medications out there that can help with that as well too, but it doesn't involve any kind of obsessions or compulsions.
Yes. And there's another aspect to ADHD that gets often overlooked, but there's
Sure.
been more talk about it recently, and that's being hyper focused.
Okay.
And people with ADHD can become hyper focused to the exclusion of things around them. And that might look like obsessive
Ah,
behavior, but
yeah.
it's hyper focused on one thing, and when you're done, you're done.
Okay.
So you might hyper focus on a report or task because you become very attentional when you perhaps have a deadline. And there's a lot more talk out there about different types of ADHD and how different types respond. So if your question was about hyper focusing with ADHD, that could look a little bit more like obsessing, but you generally don't hyper focus on the same thing again and again and again.
Yeah. Okay. Makes sense. Kane asks, any tips for sexual orientation OCD? The same as we would say for any other type of OCD. Exposure and response prevention therapy is the route that you want to take. And the elimination of safety-seeking behaviors is what you want to do to maximize the effect of the exposure and response prevention therapy. Right? There's nothing really all that unique about any particular subtype of OCD, because it all comes down to being able to become comfortable with being uncomfortable in whatever way that discomfort manifests itself in your version of obsessive compulsive disorder. Adrian says, it's hard to get medicine for my OCD because germs are a real thing. Medication won't make them go away. I hate it. My knuckles are cracked and bleeding. Yes, germs are a real thing and they do exist. And yet look at all the people potentially in your life who don't wash their hands to the point of cracking and peeling and bleeding, and who have survived all of these germs around us. So one thing I always say to people who have this kind of fear, if if germs were as bad as you are, how come the population increases instead of decreases every year? Why are there more people on the planet instead of less people? Why aren't germs just taking out more and more people? You know, you don't have to wash your hands to the point of your knuckles are cracked and peeling and bleeding. You have to learn to sit with the discomfort of the fact that you do have germs on you. And I'm very thankful, in fact, to have parasites and bacteria on and within me, because those are the things that digest my food and also attack some of the bad things that might also get on me as well too, right? So when I'm washing my hands that much, I'm washing all of the stuff off of my hands. I'm washing the oils off of my hands that allow my skin to stay supple enough that when I move my fingers, my knuckles don't crack and peel. The interesting thing about people with contamination OCD who wash this much is they're actually making themselves more susceptible to germs by cracking and peeling their skin than people who don't wash their hands that much. So, Adrian, look around at the people that you trust and that you respect and work on trying to be like them and do what they do and use them as your model. All right. Let's see. Terracotta Ciabatta, one of my favorite names, by the way, Stacey, that watches some of our webinars, says she's now working with a provider. She can get started in ERP. Her compulsions get increased when she's stressed. How can you better manage your stress levels while reducing compulsions? Well, they do get worse before they get better. And that's the best piece of advice. If you're just getting started in ERP, you have to accept the fact that this is going to feel worse before it gets better. Right?
Absolutely.
Mm-hmm.
ERP is one of the hardest things I have ever done. And yet it's also the best thing that I have done. But it was terrifying. And it did get worse before it got better. And I started to obsess about therapy about 24 hours before I showed up. But there's truth to that with both OCD and SUD. I can't tell you the number of people who say, I think more about substances in group or an AA meeting than I do outside of group or AA meetings. And they question as to whether or not they should be in treatment or going to meetings because they're thinking about it more. Your brain just goes into that mode. And when you're trying to push back against something, your mind yells out, OCD's like, I don't want you to do this. So things get harder, they get more challenging. The fears come up because you're pushing back. And when you start to challenge OCD or SUD, it says, no, I'd like to stick around. So let's make you more anxious, more fearful, questioning more, promising you more, and yet it is a lie. And at some point in the process, there's a tipping point, but it does get worse before it gets better. And again, that's something that needs to be explained to people. But I wouldn't trade any of my ERP for anything because what I have now was worth it. So, but terrifying? Absolutely. I've done a lot of therapy. I've done a lot of therapy. ERP was like the Olympics of therapy.
Yeah. I have anxiety and tachycardia and actually had an abnormal EKG a few days ago. I feel anxiety is going to end up killing me. I have a resting heart rate over 100. So there's multiple ways to address that, right? Number one, you can do things like muscle relaxation exercises and yoga and meditation, and get a good workout regimen going as well too, to help you with all of those things outside of any ERP that you're doing. Okay. And then you have the ability also to do ERP to the things that are anxiety provoking and learn how to not be so triggered by them and allow for the discomfort to pass. And then you'll also, I think, see a calming effect from that as well too, as fewer and fewer things become stressful to you. So when you're doing ERP, you're fully doing ERP. You're not engaging in all those other things. But outside of ERP, you can do other things that are also very calming and relaxing for you to do. And that's fine. That's not going to interfere with the therapy. You just don't want to do them both at the same time. They can interfere with each other then. All right. Wow, we're getting close to the end here. Stacey, anything that you want to add at the end here to wrap us up?
Well, I don't know who asked it. I've been scrolling through the questions, but somebody asked if OCD is genetic. There's a component of that for OCD. There's also that for SUD, but it's multifactorial. So yeah, genetics plays a role. Sometimes it just shows up. Like, I'm the only one with albinism in my family, which is also a genetic disorder that causes my vision problem. So yes, there's a genetic component to it, but it's not the only factor. So some people in your family may have it and other people in your family will not. And we understand a lot, but we don't understand everything as to how OCD develops.
Yeah. And I want you to end on this one, Stacey, because I scrolled down toward the end. It says, Dr. McGrath, the way you talk about OCD makes it sound like a demon, which is great. I'm glad that my message is getting across. That's wonderful. It's always chasing us and wants to steal our joy. Interesting. Stacey, was your life full of more joy with or without OCD?
Without.
Okay. Did OCD bring you joy?
No.
Did OCD tell you that joy was available as long as you did what OCD wanted?
No, absolutely. And SUD told me the same lie.
Yeah. Okay.
I didn't have an angel. I had a devil.
Yeah. Yeah.
So no. And again, just, that's why we named our talk, 1 is too many and 1,000 is never enough, because there's just no satisfying it. It steals time, it steals joy. And as we said, nobody walks into our office saying, hey, I think everybody loves and admires me and my life's going to go great. And, I really want help getting rid of those thoughts. So, right. Yeah.
Well, as always, I want to thank you for being with me here this hour, Stacey, and for everybody too. It's always amazing how fast this hour goes whenever we do this, by the way. I'm shocked. Reminder, this tonight was brought to you by NoCD, an online platform for obsessive compulsive disorder. If you're looking for treatment for OCD and you're here in the US and you want to use insurance, check us out at nocd.com. You can schedule an appointment. And we are also treating hoarding, and we do education sessions and all sorts of things too. And you can go online at nocd.com and check everything out about us and our therapists and everything too. So Stacey, once again, I want to thank you for being here. As it's a joy as always. And now we'll have to see when we're doing this next, because I believe you might be on a little bit of a vacation the next time we have one of these scheduled. So we'll have to, we'll take a look there, but fret not, everyone. If we're not here next month, we'll be here the month afterwards. So thank you, everybody. Have a great evening, and we'll see you again soon. Have a good night.